Trevor Miller. My wife, Jessica, is in the stands here, and we are the treating partners for Integrated Health of Indiana. Tonight I'm going to speak to you about functional medicine, foundational health, what it is and why it's important. So, one of the things that we have to realize, and when we compare ourselves to everybody else, our healthcare system is the most expensive in the world. And when they rank us to the other 11 countries, we rank last in every metric except how care is given. So we can thank our nurses for that because they're usually the ones that implement the care. When we start to look at America, we are 4% of the world population. When we look at the deaths from COVID, there were 7 million deaths from COVID. We were 1.2 million of the deaths. That puts us at 17%. We were 4 times more likely than any other country to die from COVID. Why is that? The CDC actually asked that question. They said, why are Americans getting such a poor return on their investment? And what they found out is that most people in America have 4 comorbidities. So we are all walking around with diabetes, high blood pressure, high cholesterol, metabolic syndrome, whatever the case may be. Those all cause a drag on the system, and they're all reversible lifestyle problems. So when you start to address, and this is what we don't do, we are the I'll sleep when I'm dead. I can just grab a packaged food that doesn't have any nutrition in it. We don't move. Stress. Who has stress? Does anybody here have stress? I don't have any stress. So when we look at this, there are really only basically 5 pillars to health: sleep, nutrition, movement, stress, and community. There's a great book by Dr. Casey Means that just came out called Good Energy. And that will give you a great introduction as to how we have been betrayed. But with that being said, sleep's real easy. 8 hours, should be unassisted. Nutrition, good whole foods, minimally prepared. If it has a UPC code on it, it's probably crap. When we go into movement, you've got to support all of the different systems. Next, you got to be able to identify and handle stress. And last, you got to have a good community to support you. Why do I talk about this? I'm triple certified in functional medicine. Just the IFM certification alone puts me in the air of about 2,000 other doctors that do this. So the last one that was on there was called the Kalish method. And so when we look at how to treat somebody with functional medicine, we want to treat everything, because you are not just an arm. You are a system, and everything works together. So we start with the neuroendocrine system. And when we start with the neuroendocrine system, who's tired? Who doesn't feel good? Those are your neurotransmitters. Who has a lack of energy? So are the mitochondria working correctly? And then last this says female hormones. We test all of our functional medicine patients. Sorry guys, we're not exempt. When we look at the GI system, we start to look at pathogens, foods, something called leaky gut. Medical system doesn't like that word. They like hyperpermeable intestine syndrome. So we just call it leaky gut because that's what it is. Next, we want to look at the detox system. If you burden your body so much and you start to make your liver decide between, can I make energy or do I need to clean house? Well, that's when things start to drag down. So you really, really need to protect these things. And not only do you need to protect these things, but we've got to get back to a simpler way. And that's really what functional medicine is about. Functional medicine is about getting back to us taking control of our own health. Because what happens if a flood happens here and we can't go to the pharmacy? Or we can't go someplace and get a shot, a booster, or whatnot. You have to be able to take care of yourself. So in this last little bit, everybody hears about detox, but you have to get the whole thing moving together. And that's what Integrated Health of Indiana does. It helps you implement a system, and it helps teach you. We use other practitioners. Somebody that we work with, Kristen, is going to present here shortly. And that's what we want to do. We want to give that power back to you. We're here to answer questions. I believe that's my 5 minutes.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.